Now, Candida is a species that is part of our natural human microbiota. It is a yeast that lives in the human body and is one of the many different kingdoms that make up our digestive microbiome. It inhabits different environments in our body. It's in the digestive tract, so the oral cavity, for example. It's in the gut and in the intestines. It's also found on the skin and the lower reproductive area, so the vagina and the genital environments. Now, under normal conditions, Candida is kept in balance by our immune system and other organisms in the body as well. But if a person is compromised and then there is a disruption to that normal balance of Candida, then it starts to overgrow and turns into a pathogen that is capable of producing infection and disease. Now, Candida infections are quickly becoming one of the most prevalent conditions that affect men and women globally. Infections have a wide range of impacts that we're still, after many decades of research, only really beginning to understand. And some of these impacts will range well beyond the commonly known thrush and digestive symptoms and have the potential to create some very serious health complications. So as we look for new and emerging treatments that can be used in the treatment of Candida infection, we have found Horopito, which has emerged as a novel therapy for us to use. It is a fascinating ancient herb, and it has a long tradition of use in treating a range of health conditions. It is a unique herb, and in many ways that provides us with a further option that we can use in our treatments. From a research perspective, it has some really interesting therapeutic activities. It has shown to reduce the growth of Candida species. It's also shown to have more of an enduring effect in preventing relapses of thrush and infection. So what I really want to do today is to give you a little bit of information about how it works and look at what combinations we could possibly use it with. So far, we have tested this herb in a small pilot study, and I'm going to talk about that shortly, and we're going to look at the results of some of those case studies that we did.